Hello, my name is Dr. Philip Mease. I'm a rheumatologist based in Seattle, Washington. I direct the Rheumatology Research Division at Providence Swedish Medical Center here in Seattle and conduct clinical practice in rheumatology. So Guselkumab is capable of binding to CD64 binding sites on monocytes and other immune cells that are at the place of inflammation, be that in the joints or the skin. So if we could borrow a phrase from a famous musical, Hamilton, it's acting in the room where it's happening. And so it's really acting right at that site where these particular mononuclear cells are emitting interleukin 23, and therefore the drug is there to bind to that interleukin 23 and neutralize it. So we are thinking that is a potential advantage to be able to be right there to capture the IL-23 as it's produced. About 30% of patients with psoriasis will ultimately develop psoriatic arthritis. So it should be top of mind for dermatologists when they're thinking about treatment for their psoriasis patients and making suggestions. Sometimes the patient may not have musculoskeletal symptoms, but sometimes they will, and it's all these discussions are occurring in the dermatology office. So I think one of the things that this does is it gives reassurance to the dermatologist that if the patient does have psoriatic arthritis, that it's something that's going to inhibit structural damage progression. And so that's an important thing for them to know about. I don't expect a dermatologist to be carefully assessing joints or ordering images of joints to tell whether or not there is that kind of damage present or not. But I do think that they're going to think about it and be aware that here I've got a choice of using a pretty safe medication. It's conveniently only given once every 2 months, so patients like that. So I think that that's all should weave into the discussion that the dermatologist is having with their patient. Just that it's a good time for us in both dermatology and rheumatology to be treating our patients because we have some very good options for uh, treatment to try to achieve either remission of disease activity or low disease activity states, and really try to give the patient back their life. And it's very rewarding to be able to work with patients and see the kind of improvements that are occurring and really celebrate that with them.